It is my hope that this book will accomplish: 1, it will be a source of empowerment for persons with disabilities as it informs service provision directly through policy making and programming. Secondly, and of equal importance, it is my hope that this book will clearly identify some of the structural barriers and inequalities that persons with disabilities experience. It will give voice to the lived experiences of persons with disabilities.
I'm looking for this book to really bring out, substantiate what we've been talking about for years. And with the writer of the book being so knowledgeable on disability issues, having done research during her various studies, I am sure we will find that the book can be used as an academic reference material, and we can also use it when we are talking about issues related to inequalities among persons with disabilities as it relates to the rest of the society. You know, when we are looking for comparatives and also similarities. So I'm looking forward to reading this book and really having it as a reference material for supporting some of the issues that we've been talking about for so many years.
What Dr. Gayle-Geddes has done is to add to the advocacy, but this time with scientific data. So when you step into a room and you're going to talk to Minister Palwell about access, you can't just tell Minister Palwell, you know, that boy, it is important for persons with disabilities to have access to the technology. You have to explain to him why it is important. And then you drop a quote from out of Dr. Gayle-Geddes' book. But in order for you to do that, you have to read the book to give the quote. But it is an important tool to use in the advocacy process.
The book is very relevant to policy development and program development in the Caribbean. We have very few pieces of research that look specifically at persons with disabilities, and here we have a book which is giving us a very detailed procedure on how to improve the lives of persons with disabilities. I also want to extend it to the fact that the book is valuable for teachers of policy, any type of policy, social policy or public policy, because here you have a book which is going to help students to understand the challenges that persons with disabilities face and be able to themselves see what kinds of policies that can be put in place to improve the lives of persons with disabilities. So it's not only for policymakers, but it's for persons themselves who have disabilities. It's also for teachers, and it's also for advocates of persons with disabilities. So those who are willing to advance the cause of persons with disabilities will find that book extremely useful, and I look forward to reading it.
I'm looking forward to hearing the public policy and program on how to prioritize, because the content goes through education, work, and opportunities. Now, obviously, without education, then there's no hope of us getting onto work opportunities. The inequality at the education level has to be addressed first, and so otherwise there's no point us going on to the next level.
I'm very excited to see the book Disability and Inequality becoming available to us, because one of the challenges that I found when we first started the work over 10 years ago was that there was pretty much hardly any information that was updated on disabilities in Jamaica. And so, for instance, I had no idea what services were available to my child. I had no idea that my child was entitled to education. I had no idea that my child had rights. What I love about this work is that it is the first piece of homegrown work in about 30 years that gives this kind of focus on disability. And it's not just on disability from a top level perspective, but as I saw in the foreword, you know, about the lived lives of persons with disabilities, and that really jumped out to me because there is a perspective of disability that is very administrative, that doesn't reflect the true situation and experiences of the people who live it every day. And so to see a body of work that recognizes that distinction, that it highlights that there is a lived life, and then outside of the lived life, there is a systems life, the policy, the education, the health, the training. And so I'm very excited for this body of work, and I believe that it will be a very instrumental piece of work.
This publication is timely, it's important, it lends to the policymakers as we improve, develop legislation, develop programs for the sector as it links back to the UN Convention on the Rights of Persons with Disabilities. And certainly in the academic field, for persons who are now pursuing a course of study as a good orientation for them, and to see areas where they can build on. And so we will have a wealth of information here in the region on this sector that we're all working for, and a society that is going to be all inclusive. So we certainly want to have equality for all, and here is some material that would give us the kind of orientation that some of us who don't have all the experience would certainly be able to learn from.
And I'm so very pleased about the work that Dr. Gayle-Geddes has done in the compilation of this book that will provide for us, all of us, government included, important data on this significant community, and for which will enable us in our planning to plan better and to execute better.
We are excited by the prospect of Annicia sharing information about disability and inequality in her publication. So as we look forward to reading her book, we go with a view to finding data that can drive our activities, data that will help us to understand in a deeper way the profile of the sector we seek to develop, identifying the numbers of persons that we're trying to cater to, understanding the gender ratio, the geographic location of persons so that programs can be better placed to serve the population.
The lived experiences, which is, for me, that's the most important point in the book. Hearing the voices of the persons who are experiencing this disability and what are the challenges that they themselves face. When we hear the voices, that will help us, because that's not our reality, to be fair. We can only assume what these realities and what these needs are, but only the persons who live the experience can actually tell us what it is that their needs are. And based on us as policymakers, this will help us now to assign a costing and help us to forward plan, future plan, and to put in place other things that that population may need in order for them to live productive lives.